Today, we're honored to welcome Dr. Maria Sophocles. She is a board-certified OB GYN with nearly 3 decades of experience.
What happens to the body when the ovaries stop making estrogen? Because that's what menopause is. It's the little tiny almond-sized ovaries, which are honestly the powerhouses of female health.
Because I think so many women are grieving, but they don't even know what they're grieving. I just thought I was broken.
How do you first take those first steps to say, I'm not happy and I got to figure out, because you know what most women do? They internalize it as shame.
Hello, everyone, and welcome to the Relationship Renovation podcast. I am Tarah Kerwin.
And my name is EJ Kerwin, and I'm excited to read this intro and just dive right in because I think people are going to love this. This is so today we're honored to welcome Dr. Maria Sophocles. She is a board-certified OB GYN with nearly 3 decades of experience. She specializes in menopause, female sexual health, and hormone optimization. She's trained internationally on cutting-edge treatments, including non-hormonal options and CO2 laser for vaginal health, and is a passionate advocate for closing the bedroom gap that many women face in life. And this is kind of, I think, what people are going to love is we're going to be digging into how hormones shape connection, intimacy, identity, and relationship wellness. So welcome, Dr. Sophocles.
Thanks, EJ and Tara. So glad to be here with you.
Yeah, well, you go ahead. You jump.
I was just like,
in.
I was telling Dr. Sophocles before this could be a 4-part series because there's so many different avenues we can take here. But a lot of our listeners, it's the intimacy piece or the lack of intimacy and misunderstanding and wrong psychoeducation and miseducation. And so we're just so thrilled to have an expert in the field here with us today so we can just get down to what is important, what is true, and how can we help our listeners have knowledge now so they don't have to face this alone. Because I can just share, I'm going through it right now. I haven't had my period in 8 months now, and I wasn't expecting it. I thought I was going to happen in another 5 years. And I had to do massive amounts of research on my own for multiple doctors who just wanted to put me on Wellbutrin. I'm like, I don't want to be on Wellbutrin. And so I finally just got into my doctor who used to be an OB/GYN, and she saw the same struggle. So she opened up her own hormone wellness center in Tucson. And so I just started there, but I'm an advocate for myself, and it's crazy that you have to do so much work and get so misguided. And I'm thinking, man, if I have this information and I could have easily taken what all these other people wanted to do, we have got to have someone here in the field that can help us.
Is that a similar story? Is that what you're like?
Yeah, I hear Tara's story about 10 times a day, every day. So it's not just you, Tara. And I want to tell you why it's happened. So you don't feel like, what is it? Me? Is it Tucson? What is it? It's a ubiquitous thing in all 50 states and in other countries. When my TED Talk came out in the spring of 24, my phone started ringing not just from Iowa to Maine to Florida, but Buenos Aires, Singapore, Spain, France. And that's when it hit me my gosh, we need to get our act together and do better for women actually globally. There are about 1 billion menopausal or perimenopausal women on the planet right now. At least 500 million of them are suffering from vaginal and sexual issues, and they're suffering really quietly because it's shameful. Mm-hmm. So people with hot flashes get the courage to go to a doctor and ask for help. But people where they've lost libido or the vagina's dry or sex hurts, they hold that inside and just own it as there's something wrong with them. So we're talking about 2 different things. One is menopause and the lack of accurate information about menopause. And the second is the sexual fallout of menopause that can be relationship wrecking. And that's a concept a term that I coined called the bedroom gap, which actually relates to the difference in expectations and abilities between partners. Can be same-sex partners, but for sure between men and women in the bedroom. But the menopause information lack is enormous. And the reason for that is that medical education was pretty much written by, white guys 50 years ago. Nothing wrong with white guys, by the way. But the menopause curriculum got kind of left out, just kind of conveniently, I guess. And even when I trained in the 90s, and I trained at this world famous place in Baltimore, we were told menopause is just part of life, and, just kind of pat them on the shoulder and say, you can get through it, Tarah. Can you imagine you train at a world famous place and that's the tool you're sent out into the world with? So I did a really crappy job when I first was in practice, because that's what I was taught to do. And I was leaving women high and dry. They were saying, I have emotional ups and downs. I'm crying all the time. My hair's falling out. My shoulders are stiff. My vagina's dry. I don't like the way my husband smells anymore. I mean, the statements were crazy. Yeah. And so I was thinking, oh, this woman, maybe she needs a rheumatologist or a psychiatrist, because that's all I knew. And I was just like all the other doctors trained in my era. So sadly, 90-something% of doctors still out there still don't have menopause training. So that's why people like you, Tarah, have to go to 5-6 people and then find sort of hormone clinics or gynecologists who are just doing menopause. But beware, buyer beware. There's a lot of money to be made out there, which means a lot of people are setting up clinics who don't honestly follow evidence-based medicine. So I think your listeners have to be very aware that just because some shop in a strip mall says we do hormones, it could be literally someone who was working at Home Depot last week. And that's, I hate to be like that, but that's true. I mean, you can go on menopause.org and find doctors who've taken a basic course. Better than nothing.
Well, and didn't you get told right away, don't get on hormones. It's going to increase your chance of cancer. Yeah. So do anything but it. I mean, I remember that at the very beginning.
Yeah. I mean,
and that's someone who hasn't read something in 23 years, because that information came out 23 years ago and it's been largely disproven. Yeah. But you guys know that bad news is hard to die, right? If I tell you a restaurant had crickets and rats in their kitchen 20 years ago, I don't know, you still don't want to go.
Sure.
You just don't want to go.
And that's a big,
Well, no, I was just going to go back to all these centers or clinics popping up because people are desperate now. And now that there's all this information, it's almost like overload. It's just okay, it's like people are just desperate. And so it is so important. It's like when people are coming to couples counseling, you've got to go to somebody who specializes in it, because it's such a certain type of training that we don't get in graduate school. So ask those questions, because otherwise it could be a total train wreck if you go into a clinician who has no idea how to manage a couple.
Well, and it's a cluster of sort of symptoms they're dealing with, that part of it is it's having a profound relational effect in your relationship, but then part of it's super physiological.
Yeah.
And so how does that cause problems in the process?
So you guys are the relationship experts, and technically my expertise is in the physiology, right, of what happens to the body when the ovaries stop making estrogen, because that's what menopause is. Mm-hmm. It's the little tiny almond-sized ovaries, which are honestly the powerhouses of female health. They are not just for having babies. They affect every organ in our body. So in menopause, the ovaries stop making estrogen, progesterone, testosterone, 3 critical things. And that impacts the heart, the bones, the skin, the brain, so much. And part of the brain effects have to do with libido, with mood, with so many things that affect our relationship. And so men don't know this. Actually, women don't know this. So men come in to me saying, I don't know what to do. I literally don't understand it. Yeah. And women come in and say, I'm not myself. Give me something to make me myself again. And the truth is, I think the first thing we have to do today is clear up the hormone myth. So the reason people link hormones to cancer was a study done 23 years ago that was misinterpreted, incorrectly, thank God, interpreted. And the taglines, the clickbait lines, estrogen and cancer, just went like wildfire. And even today, many, many doctors will say, oh, I don't want you to do that. You'll get cancer. Or your friend or your sister or your hairdresser will say, I got cancer and I was on those hormones, so it must have been the hormones. Well, both of those are not true statements. In fact, we know now that women who, when their ovaries stop making estrogen, progesterone, testosterone, actually put those hormones back in their body, we know that the long-term health benefits are astounding without the cancer risk that was previously thought to be there. So your risk of overall death, your lifespan, heart failure, osteoporosis, dementia, all those risks improve. Now, women who take both estrogen and progesterone, which means anyone with a uterus, there are still studies showing a very small increased risk of breast cancer. And some women say, oh, forget it, then I won't go on it. But I would say when you get in your car, you do have a small risk of a fatality every time you get in your car. You have to trade that away from the incredibly massive risks, or benefits rather, that we now see. And they're massive, like a 40% reduction in colon cancer. Like you can't get that from, anything.
Can I ask you a question? Because this was what was hard for me, because I was still having my periods, but I was like, not me. I just wasn't me. And I said to EJ, just think of me as with a broken vagina, buddy. Like that is
I literally read that on your website the other day when I was doing the research. You said the exact same thing.
And then
my vagina's broken.
Yes. And then I was like, okay, well, I just can't wait to not have my periods for a whole year so then I can go on something. Like I kept thinking in my mind that I couldn't get on anything because I still was having them. Yes.
But you can, Tarah. So if you're in what we call perimenopause, which is the 2 days to 12 years when there's what I call a hormonal roller coaster. It's actually harder than menopause because doctors will say, well, you're not menopausal, go away and see me when you haven't had periods. But the truth is you absolutely can smooth out that craziness and begin to get the benefits of that. You just need to find a clinician who will be happy to help you.
And here's what's interesting, because once I realized that and I started to like get on my progesterone and my estrogen patch and the testosterone, I was like, I think I've been in perimenopause for like 7 years, but I've just been white freaking knuckling it, literally. Therapy, white knuckling it. It must be from my past trauma. And then I get on these hormones and in a week I'm sleeping. I could cry because like my sex drive comes back and I haven't had one in like 8 years. And I was like, what is this feeling? And I was just like, because I think so many women are grieving, but they don't even know what they're grieving. I just thought I was broken. And I'm sure like everyone's different from all of their like meds and stuff and hormone replacement. But I was just like, I'm not broken. Like I have a sex drive again. This is crazy. And so I realized I was probably going through it for like 7 years. And so if just one person's listening to this and knows that like there is help out there, like I am living proof, you are living proof of thousands of women. So,
well, and I think that like what complicated for us and what complicates it for a lot of our clients is we have a lot of clients who are like in their mid 40s and also were professionals. And so they had babies late. And so they got, they had babies when they were 35, 36, 37. And then that offline their intimacy for a little while and was a big adjustment but then perimenopause comes like swinging around the corner, like right at the moment. And so like, we were like, well, is our sex life like messed up because we don't make each other a priority and because we have bad communication and because we're stressed out by our family and our business? Or is it perimenopause? And it was just like, we reeled for like a decade and then you add in that male hormones are so much easier, it seems apparently, easier to deal with, where I got one hormone that like when that started to go down, I had a doctor who was like, yeah, let's give you that and jam this needle in your leg once a week. And my energy levels went back up. My sex drive went back up. It was a quick fix. With Tarah, it's been
I was like diagnosed with OCD. I'm just a perfectionist.
It's been a nightmare, right?
Yes.
People told Tarah, like, you're not supposed to want to have sex. We had a doctor tell you, right? You're not supposed to, like,
yeah.
And we were just like, okay, well, wow, we are like freaking, what do we do?
No one told us. Yeah. Oh, okay. That's the right answer. Do you know what that's called? That's called a convenient answer and a way to get you out of the exam room quickly.
Absolutely.
And that happens when professionals are not trained. Remember, doctors are trained to be the smartest person in the room and the one with all the answers. So one of the biggest hacks that doctors learn is if you don't know the answer, reassure the patient that they're okay or that's normal and get them out. And I'm not just crapping on doctors. I'm actually just frustrated that we weren't let out of training with the proper tools to competently admit to patients that we don't have the skill set to help them with this. And so one of my missions is to get med school education revamped so that every physician in every specialty knows that menopause happens to, mic drop moment, 100% of women born with ovaries and a uterus. Yeah. So this could be a whole lot of people. And if you're not going to get trained in it, at least know how to refer. And also know what it does to your particular organ part. If you're an orthopedic surgeon, know when a 55-year-old woman comes in, that her shoulder could get better with estrogen. Yeah. If you're a cardiologist and your 50-year-old patient comes in with palpitations, don't just tell her she's anxious because she's juggling too much. Ask her if she's menopausal. So we have lots of room to improve this. Tarah, your story is real. Mm-hmm. It's common. I'm validating it. I wish I'd met you a decade ago, but you're right. You and I, if even one person is listening, and she can be 35, by the way, this doesn't have to be 47. Naomi Watts was someone who at 36 started becoming perimenopausal. It can happen earlier than you think. If your periods are irregular, moods are irregular, sex drive is waning. I mean, therapy or talking with you guys is absolutely sometimes the absolute gateway drug. But imagine if all the therapists like you also knew that there could be hormonal background and you guys could send them to people like me. I mean, it's a perfect marriage if you think about it.
I'll tell you though, that's on our side, the clinician side, that's like a hard line to walk when you're like, when there are relational issues too, and you have a partner who's emotionally checked out, and you try to balance like, okay, let's help them with their communication, emotional safety, but then also say, and especially honestly coming from a man, of like, well, let's also check out your hormones and see how that's
how's your vagina? Is it dry?
Well, and because then like it's like, the husband's like, yeah, I just think she needs to get her hormones in gear, and then she'll stop being so demanding of my emotions and all of this. And
you're right.
And it's a tough line. I think it's easier coming from Tarah to a client, a female client, than it is from me.
Because she can state her own roller coaster decade. But for sure, any therapist has to find the comfort. I mean, in saying, and just being humble and honest, right? And saying, look, this isn't my wheelhouse, but so I had to go get training as a sexual counselor because I felt so unable to walk that same line. And I don't hold a candle to your expertise, but at least it gives me a few basic tools to walk that tightrope a little. But what I'll do is just say, I can help you 100% with the physiologic stuff. Yeah. But what you've shared with me, that your husband's a porn addict or that he's now with his 20-year-old administrative assistant, these are things that probably require some deeper relationship evaluation. But the physiologic stuff, EJ, it's simple to fix. It really is mostly very simple.
Well,
to
let's
fix.
talk about that. Let's talk about the bedroom gap, because for our listeners, for sure, but still with us, even though Tarah's has been in treatment with this new clinician, it's still been like really confusing, right? And you're still like, we just had like a bump is okay.
Yeah, that's
this
fine.
bump in like they shifted her testosterone, and it offlined everything
from injections to cream for me. And for some reason it's been 2 weeks, and it's like I went from like having the sex drive to nothing now. But I'm just trying to be patient because I knew that it did happen.
Yeah.
But it's also, I see it like driving you crazy.
Well, because it's that thing. It's like it comes back for a little bit and then it's gone again. And it reminds me of all of the pain we went through for so many years because we didn't know what it was. And it's just that grief comes back. And then I think about other people who don't have a voice to it. EJ and I created our couples counseling center and our podcast because of the suffering we went through after our family. Like, we're so compelled to like grow in our awareness and in our relationship together. And I'm so grateful for that. But I think about all the couples who break up and don't try because it's so, it feels like you're powerless in it. And so yeah, it's like you get something figured out sort of, and then it kind of gets taken away from you. And of course, EJ and I know how to talk about that and process it. I'll wake up, I'm like, oh, my sex drive is gone and I'm so sad. But I'm gonna be hopeful, but for other people that don't have that emotional safety within their relationship, it's so fracturing, and that's where my heart lies.
Yeah. There's so much we can talk about. I mean, one would be testosterone and what is it? How do you get it? How does it help? Does it help everybody? And I think we probably should hit that. And then the other is just about how do you begin to have that communication with your partner? Because, what I would say, communication is lubrication, right? It's its own sexual powerhouse. And I've had so many couples that have said, that have confessed to me that they've talked about taxes and their kids and their parents and their pets, but they never talk about sex. Never. They just have missionary position sex every Friday night at 10 o'clock, kiss, lubricate, penetrate, go to sleep, and that's their sex life.
So how do you help somebody differentiate when they come into your office between like, is testosterone, is hormones the missing factor in the sex drive, or is it relational?
Yeah, easy. So the first thing is we take a good history, right? What did you learn about sex from your parents? What did you learn about sex from your other partners? What did you learn about sex from this partner? How is this sex life? Have you had any childhood traumas? Have you guys had any traumas as a couple, like infidelity or divorce and remarriage or something? And that all takes like an hour. I spend 2 hours with my patients for their initial visit, which is pretty rare for a doctor. But it's because this is so multidimensional. I mean, and then I end up examining if the woman has sexual pain or she just can't have penetrative sex. I really want to examine her, because when we lose estrogen in the ovaries, we don't just get hot flashes and stuff. It affects the vagina, the vulva, the bladder, and it's chronic and progressive. Mm-hmm. So and if you've had breast cancer or are on anti-estrogen medications, it can be much, much worse. So I can look and very quickly, like in 3 seconds, see, does that woman have tissue that has the benefit of estrogen, or is it deficient? If it's deficient, meaning pale, rigid, not stretchy, not moist, wrong pH, then vaginal estrogen is like liquid gold. Yeah. And it will correct. Now, I'm not talking about libido. I'm talking about pain and ability to get wet. Because if you can't make moisture, it's very hard to have comfortable sex. You can use lube all the time, and that's great. I tell people, use lube like voting, early and often. But if, lube only goes so far. And the vagina amazingly can be rehabilitated literally at any age. If you guys send me a female anywhere from age 30 to 90, and there's estrogen deficiency, 3 months of vaginal estrogen, which is crazy safe, by the way, crazy safe, will will really make new blood vessels, new collagen, and restore moisture. And believe it or not, something as simple as the ability to feel moisture, which you feel and your partner feels, can be relationship rebuilding. Because when you can't get wet, you know it, your partner knows it. This is all in my TED Talk. So if you guys link to that.
Yeah, we will. Absolutely.
I think people will watch the little animated video and the TED Talk and they'll get what I'm saying.
Yeah.
So what's the difference
really
between the patch and you're talking about like some sort of a cream or something?
Yeah. So vaginal estrogen is a cream or a ring or a suppository. Lots of companies make it. It's not over the counter, unfortunately, but it is crazy safe, like probably safer than Tylenol or Advil. Like it should be over the counter. It's so safe. They've looked at 1 million women, including women with breast cancer, and there's zero risk of recurrence of that breast cancer. So very, very safe. So you can get that from an internist, from a GYN. And honestly, if you're having vaginal dryness or pain with sex, you should not leave a doctor's office without it. You really shouldn't. And by the way, you can use it till death do you part. It's not like antibiotics. I mean, you use it as long as you use seatbelts.
Yeah.
Right? We don't outgrow the safety benefit of seatbelts.
Yeah.
That's vaginal estrogen. But systemic estrogen, which is a patch or a gel, which is pretty much all transdermal now. We don't really use the oral anymore because it's safer if it goes through the skin. That is what you use for hot flashes, memory stuff, mood stuff, short term, all those short term 30 something symptoms. But you also use that for long term health to prevent osteoporosis, to help with dementia and rewiring neural pathways. It probably also helps reduce heart disease, stroke, but we're not allowed to say that yet because we don't really have enough research. But all the cardiologists who do research on this know that it helps with that too, which by the way is the number one killer of women. So that's why I was earlier saying using the estrogen patch from, well, let's say most important timing is sort of age 50 to 60. Can Tarah use it? Can someone use it under 50 for symptoms? Absolutely. But from around 50 to 60 is when we have the most rapid loss of bone health and probably the most rapid acceleration of cardiovascular disease in our lives. So that's this magic little window where if I had a fantasy, it's that every woman in America would get this free from the government with your tax forms for a decade. And then we would have so much less disease in the 60s, 70s, 80s, 90s, So that's what that is. That's the difference between those two.
And you can use both.
Sorry, a lot.
No, it's so good because you can use both, right? The patch and the...
You can use both.
Yeah.
We don't overdose. In fact, if Tarah, I put you on the patch and you said, oh, yay, my hot flashes are better and I feel happier and I sleep better, but the vagina is still kind of dry or I wish it could be healthier. That's because the patch is so low dose. It gets so diluted that by the time it gets to the vagina, it's pretty low dose. It's not always enough to help. So I almost always give women both. You're not overdosing, underline exclamation point.
Do you, when you're doing the assessment and right, because we're losing the progesterone and testosterone and estrogen, is it always like a 3-part series or do you?
No. If you don't have a uterus, you don't need the progesterone. So if you have had a hysterectomy, you only use the estrogen. Remember, the testosterone is sadly, really sadly, there is no FDA approved testosterone in America. So you can't just go to Walgreens and get a prescription from your doctor and go. You have to either get it compounded from a compounding pharmacy and pay more for that. And you either use injections or cream. The injections are a much higher dose, so a much more robust response to your libido. But there's a trade-off with those higher doses. Those doses are higher than normal female doses. So while you might feel great, you might be able to build more lean muscle mass. You might have a stronger libido. And by the way, amen to all three of those things. You might see a little acne, oily skin, even a couple stray hairs where you don't want them. You may lose some hair in your scalp. Like, it's not a perfect situation. Whereas the creams don't necessarily deliver as powerful a punch. And you found this yourself.
This is interesting.
But
I would
in a,
never,
quote, safer dose.
I would have never, because when I was on the shot, I was getting pimples all of the time. And I'm like, what's happening? Well, now it's been 2 weeks and I have not had one pimple. Maybe
That's right,
yes. But I mean, I'm telling you, Dr. Sophocles, like when I was doing the injections, I would get a wave of like, I have got to go find my husband right now and just pounce on him. Like I was like a high school girl again. And I'd be like, EJ, where are you? And so I'm like missing that, but I'm also like, hey, I know it still exists. I thought maybe there was something wrong with us, but I was like, no, it was literally just whatever testosterone does in conjunction with all the other things.
Well, why can I go get testosterone at just basically any pharmacy, but Tarah can't?
Okay, ready? Because we in America have, I'm making up this term, we have genderized the steroid hormones. So steroid hormones are testosterone, estrogen, progesterone. And in America, someone decided that testosterone's for men and estrogen's for women. And so the FDA bought into that and approved testosterone for men and estrogen for women. A drug company spent almost $1 billion to get testosterone approved for women, and it was rejected at the FDA. They said, really? I mean, do women really need this? Like Tarah and I should have gone and pounded on the door of that meeting and been like, yes, damn it. So that was a waste of $1 billion. But now new companies, because menopause and perimenopause are now coming out of the closet, companies are working to get that again. So I really think it's coming. It's going to happen. It might be a few years, but it'll happen. So that's why.
And here's the other thing. I pay $25 for 8 times the testosterone,
the amount
that she pays $200 for like a fraction. And I mean, how screwed up is that?
We call that the pink tax. In my world, we call it the pink tax. It means for women to be able to get something for sexual health. It's like society says sex is for men. And this isn't our side. Right? This is the last 10,000 years.
Yeah.
When you look at ancient Egypt and ancient Greece and the Renaissance and every society, it's always been women are property, men are entitled to sex. And so it's that's what's in my book. The book is a look at what happens to sex in midlife, but also the forces that shape why you can get testosterone easily and you can't, why women feel shame when they can't orgasm like they do in the movies,
Okay, I got a good one for you then. Okay, this feeds right into your bedroom gap. Is like, okay, like literally 10 years ago, I go to the doctor and I'm saying like, wow, like it feels weird. I'm super bummed. It feels like I'm not as interested. He hooks me up. I start hitting testosterone right away. My sex drive returns. Then we spend a decade of Tarah not getting this support, and hers is going the opposite direction. I'm feeling better. And then she would be like, there were times where she was like, stop taking it. Yeah. And I'm like, I'm not going to stop taking it. Cause like, even though we're not doing it, like I want to feel that even if we don't do it. I'm seeing my muscle tones better.
And I was
I
like,
have
screw
more energy.
you.
I want to have sex. And even if like we're not doing it, I want to do it, even if we're not doing it.
And you have the right as a human being.
But how screwed up is that system, right?
Spouse, you don't want to widen the gap. So your testosterone use, and please don't think I'm shaming you, widened your own bedroom gap. And the other thing that widens it is Viagra use. Remember, Viagra was invented for men with erectile dysfunction, but it became the most successful drug launch in history at the time. And Pfizer realized, hey, we can make even more money if we let Viagra be for any guy who wants it. Brilliant, right? It was financially brilliant. But what that did to women who were aging and getting drier and losing their libido was it created this giant bedroom gap.
Well, that's got to be where
And
porn and cheating comes in, because I mean, let alone testosterone having like a higher sex drive, but then you add a higher sex drive and then a 2-hour erection.
And a partner
and the
that's
ubiquity of porn. And the fact, EJ, that you can now watch porn like within 3 seconds, you can find porn. You don't have to go home and get on the VHR and VHS. And, so porn exploded. Porn came into our lives in a very easy way. Viagra came into our lives, and you can get Viagra literally as easily as you can get Tylenol, right? You can get it online. Meanwhile, Tarah and I are still fighting and begging the FDA to give us something, right?
Mm-hmm.
And even there are 2 medications, by the way, that are FDA approved for female sexual desire. But even those had to jump through all kinds of hoops, right? Viagra was pushed through like emergency use, 50 people had erections, they're happy, great.
Yeah.
The ones for women, they made it so hard.
Yeah.
So we're dealing with a sort of sexism. I don't mean to sound like a feminist rant, but there's definitely a double standard, and it's actually widened the bedroom gap.
Well, and the crazy thing is like, don't they see that this is a math equation that doesn't work out? It's like, okay, if men are supposed to be empowered in sex, but you're not supporting women in it, like, where the hell are they getting? Where are you getting it? I guess it creates unhealthy relationships.
Mm-hmm. Yes,
because that's what we see so much is like people like they blame, there are a lot of men who blame their partner. Like she just doesn't want it. She just doesn't want to do it.
She's punishing me.
Yeah.
Because,
she's rigid. She's frigid. She's like.
Yeah. Well, in the book, we talk a lot about relationship disconnect and just what we're talking about. And what happens, of course, as you know, when sex is rejected, when a request for sex is rejected, first of all, then the man feels shame, like, wow, what does she think is wrong with me for asking for it?
Yep.
And sometimes it shuts down the communication, and then the man has to go elsewhere for that sex, whether it's just more porn use and masturbation or ultimately someone else. And then you just got a bigger issue than there was before.
And this is a big one too, like at our counseling center, then like, well, if we're not going to have sex, can we open up our relationship? Because I can't live like this.
Yeah.
And then it's like, well, because of all the shame the partner feels for having low desire or no desire, it's like, oh, well, I don't want them to be without. But like, there's even the questioning, even if there had never been before, because of the shame.
And consensual non-monogamy can be a viable option for some couples if that's what they jointly come to it. But it's like having a baby to save a bad marriage.
Yes.
You don't have a baby to save a troubled relationship. You got to fix the marriage, right? And same thing, I would say before you go say, let's have a consensual non-monogamy because I need to get sex somewhere, you want to make sure you've communicated what isn't right. And again, the problem is if it is something physiological, if it's menopause related or hormone related, and nobody knows that, they don't even know how to fix it. So another group that people could go online is the International Society for the Study of Women's Sexual Health, or ISSWSH, ISSWSH. It's a conference every February, ISSWSH.com. And they, often have information, and they can help you find an ISSWSH member who's a clinician who has true interest in sexual health. Some are therapists, some are doctors, but that's a nice community.
Let's just say there's a female who can't, for whatever reason, like, are there other options other than like hormone replacement therapy for women, or is it really just getting those hormones back in the body?
Well, for what? What are you trying to
like if someone's got like very little estrogen, progesterone, testosterone in their body, but they're like, I'm not willing to go on hormone replacement therapy.
For sure. So first of all, local estrogen, right? We talked about that. Even local testosterone, you can have testosterone compounded and use it locally, but those are both hormones. Okay. So some people are still so scared. They just say, no, I don't care what you say. I won't. So there are over the counter, you can buy them online, vaginal suppositories that contain hyaluronic acid, which is also in high-end cosmetics. hyaluronic acid. Now remember, this doesn't fix the problem. No new cells are made, no new blood vessels, no new collagen, but it does make everything feel really nice and moist. Okay. And you just use them 2 times a week, not in the moment. It's in addition to lube. So that's a non-prescription, non-hormonal way to just help with some sexual discomfort. Other than that, there is pelvic floor physical therapy. These are specialized physical therapists who can work with women who've either had, let's say, sexual trauma, or sex is painful. They help teach them to relax the pelvic floor, or they've had chemo or radiation and they're just like, I don't think I can ever have sex again. So pelvic floor physical therapy is a very specialized kind of physical therapy.
What I heard there, though, was interesting was when you said new cells, new collagen, new blood vessels, is that these hormones are actually regenerative.
They're totally regenerative.
I mean, that's a selling point, right? That literally your body will heal and,
yes.
I mean, that's
and I get
strong.
to see it. I get to see it because I see, like, if I examined Tarah today, I would ask her to come back to my office in 3 months, and 3 months of use of this, you can see a change in color. You can feel the elasticity. I mean, I can as a doctor, but I don't even need to examine her because she'll come in and tell me that. Now, CO2 laser is another way to have this. And this was something that I pioneered in 2015. It was invented in Italy, and I just happened to be living in Italy. So I didn't invent it. I don't want to take the wrong credit, but it got FDA approval in the end of 2014. So the first ones in America shipped to my office, and I've been using that to also make new cells and new collagen and new blood vessels. So it does the same thing as estrogen without the hormones. But buyer beware. Unfortunately, it's not covered by insurance. Insurance companies, you think they don't want to pay for testosterone, Tarah? They really don't want to pay for this. So it's only, there's only about 1,000 of these machines in the country. So Tucson may or may not have one. I get calls from people all over the country. They often will come to my office in Princeton, New Jersey, or I'll help them find someone where they live. And, because it's a nice adjunct,
We'll take a trip to Jersey, babe.
Yeah. So the next question is, and I know we already talked, we'd love to have you back again and take on more specific stuff. But okay, we have people in small towns in Ohio, and we have people in the middle of Australia, and we have, how do people find the right doctor? We've defined the fact that there's probably 50 doctors who are not going to give you good advice. Yeah. To everyone, if we're lucky. What do you say to that person who's listening right now and is like, I live in Chillicothe, Ohio?
I know. I would say, unfortunately, there's no immediate, I can't wave a wand and in the middle of nowhere is going to have someone. But telemedicine is very helpful. It's changed medicine. And there are, 2 things. One is you can find telemedicine companies that are for women's health. One of my favorites is called MIDI, M-I-D-I, MIDI Health. And they have women who are trained in menopause, nurse practitioners. And make no mistake, nurse practitioners can be every bit as helpful as doctors. Okay. And so MIDI Health is great. There are other ones that are knockoffs of MIDI or also helpful. Also, you can go on menopause.org. This is the website of the Menopause Society, where I am right now at their national meeting. And they are aggressively training more and more clinicians every year. At least the clinicians they're training have a basic understanding of menopause. They may not be great at sexual health, but you can hope that you get a menopause expert who also has sexual health help. Yeah. I do think that finding websites like mine, where there are courses and where there are books, and some of the influencers out there actually really know their stuff. Kelly Casperson, she has a great podcast called You Are Not Broken. Mary Claire Haber, The Pause Life. These are 2 of the very popular podcasters and influencers who do recommend really good things for sexual health.
Okay. Do you think that telehealth is more responsive? Because I've been on the sidelines of watching Tarah go through this. And one of the things is just like how slow and unresponsive physicians have been locally. Because Tarah will be like, well, this happened. She writes an email and they're like, well, just do it for another 3 weeks or another 6 weeks. And then I'll see you and you can decide. And I see like on her face where she's like, yeah, well, they just told me to kind of just deal with it for another month and a half before they're going to do anything. And it's just like, come on. Like,
well, I think this is why also we're seeing a lot of menopausal experts do concierge medicine. I mean, it stinks to have to pay out of pocket for stuff, but like my practice is virtual and in person because if I have someone in Iowa, I know they can't get to New Jersey, but I still always tell my patients, I will get back to you within 72 hours. And so I keep my practice fairly small so that there can be a responsiveness. And I think there are others like me out there. So
a physician like you can see somebody across state or country lines, and then you can help them with a pharmacy.
Yes. So not always. I happen to be licensed in many states, but we still have these goofy old-fashioned state laws that say, no, you can only, yeah. So most states in the US are not very user-friendly that way. That's why I took the time to go get licensed in a whole bunch of states so that I could. But some people will just call me for a consultation and then I can say, here are the 3 things you need to demand of your doctor. And if your doctor isn't giving you that, you need to thank them. And it's okay to fire your doctor. Don't be afraid of that. Just because they delivered your baby does not mean they're the right person for you now. I hate to say it.
I mean, just like hearing everything. And I'm just like so thankful for your work and feeling so compelled to get these messages out. I love that we get to deal with we get to process a lot of anxiety that happens because of that bedroom gap, because it's like, and it's like a 2-part, like go make sure that your body feels balanced, right? Both as male and female, but also, right? Like I had so much anxiety because we hadn't had a great sex life for years that I was like, okay, now it's back. Now what? Okay. Like, right.
Yeah.
It's like, so that I think both are really important.
Well, that's a whole other episode, Tarah, is I think, number one, how do you first take those first steps to say, I'm not happy and I got to figure out, because you know what most women do? They internalize it as shame.
Yep.
And they feel terrible shame. They feel their husband has needs or their partner has needs and they're not meeting those needs. And they feel guilt and shame, which we all know are useless, terrible emotions, right?
Yeah.
Or that's how I feel about them.
No,
but then the second part is, how do you begin to rebuild? Because sure, testosterone, you can just take an injection or have some cream and get a libido, but your whole relationship is more than that,
yes,
right? And it's also about rebuilding your health as a midlife woman. Yeah. How do I bring my healthiest, best self to the relationship? And so that I'm there in mental and physical health for myself and for EJ for the long run. Because especially if you have kids, you want to be healthy a long time. We call that health span.
That's
right?
a whole other component I think we could have a show about, is the
part 3.
The overwhelm, the brain fogginess, like all of that stuff that I've seen you like just really struggle with and be so like I mean, I don't know how many times I've heard you say like, I'm not me anymore. I don't feel like I'm me anymore. And for the partner, it's like, I don't know, like, what do I like? That's a hard thing.
Well, that's
to be like, what do I do with that?
Is how do you be a partner? How does the partner
I'm gonna read
learn?
it
Because you can. Well, okay, why don't you help me write it first? It's not finished yet, okay? But I think I've been going around the world interviewing men, saying, "Tell me what you know about menopause and perimenopause, and what can you?" And it's been astounding. Men want to know in general. They don't want us like this. They want to be supportive, but they don't know how, and we don't talk about it, and we can't talk to our doctors about it. So clearly there's a lot of room for improvement.
I can't wait for that podcast. It's going to be good. And for that book.
Yeah, let's think about it. Sounds like your listeners have a lot of interest in learning about this.
I think so. I mean, yeah, because it is it's like it's beyond a backdrop. It is like a storm that every relationship goes through,
And none of us
and
are
the
prepared.
partners experience it in such different ways. Like my experience of it, of my own, aging, and Tara's experience of her aging, so different. My experience of her witnessing her go through it, and you want to be supportive of it, but if you're not getting the medical support you need in coordination with it, it's really a setup to get a divorce or
Absolutely.
just resign that your relationship sucks and you're neither of you are going to get your needs met.
Well, that's what I was going to say to Dr. This is it's like an empowering movement for women, because no longer will we stay stuck in what we've been for so many years, right? So that's what I love.
And believe me, men don't want you to stay there.
No.
It's for men too. They want to hear from you what's not right. They just don't have the answers. And this is where I think the medical community needs to step up and provide that. And if they can't, then the private sector will. So some of my colleagues made a movie called The M Factor, and that's about menopause. I'm making a documentary called Hot about sex and menopause. And so, we, in fact, not a plug, a request. If any of your listeners have interest in sharing their own just sexual troubles in midlife, we really still are looking for more women or couples to interview, especially same-sex couples. We want people to be able to share their particular version, of what you two shared today. I think that's what will make the documentary compelling and make people want to hear it.
And we'll let all of our therapists know, because we have 15 therapists at our center now and hundreds of couples coming in every week. So we can even make like a little education for all of our therapists who are doing that.
That'd be great.
Yes, because we have a lot of
maybe we need to come to Tucson and do a screening. That would be fun.
That would be.
We have a great theater here called The Loft that does like showings, and it's a cool place.
Oh, it'd be cool. Cool. Well, guys, I think your listeners are going to find some meat on these bones.
And there's some great
and I'm going to order the Bedroom Gap book that comes out in February. I'm going to order it for our lobby.
Yep. And
well, you know what, guys? It's on Amazon now. And I was thinking of even sending you like some cards for pre-order.
Oh,
so
perfect.
people who see it
please
do that.
Yeah, that'll be awesome.
We'll put this up on all of our social media. So in our show notes, everybody, you can get links to both the book, to your website, to some of these organizations, to your TED Talk. We'll make sure we get everything. We'll do our part to get this information out, because we know how important it is, and we know how it will help us do the work we do much more successfully if people's, if people are getting the proper support.
My vagina is not broken.
I didn't want to go there, but if we get some,
she just needs a little
some
love.
Rejuvenation.
She needs some nurturing,
some regeneration,
possibly a Jersey CO2 laser.
There you go. Tara loves a good laser treatment. Believe me.
Well, I've just had it on my face.
Well, guess what? It's the same principle. It's teeny little injuries, and then your body makes new collagen. It's just nobody thought to do that down there till 2008.
I could just imagine you convalescing from a vaginal laser treatment.
Well, you know what? There's no convalescing. It's different than the vape. If you just get up and walk out, you're fine.
Tara got the CO2 laser.
I did.
And I was like her nursemaid for a week of like these vinegar sprays on her face.
But that's because the face is so different. Down there, think of what a vagina's been through. It's been beat up for millions of years. Like it feels like
I'm dying right now.
Sorry, Tara. TMI.
No, that is awesome. All right.
All right. Well, thank you, Dr. Sophocles. We've enjoyed talking with you, but you have been a wealth of information, and this is incredibly important.
So excited to see all the stuff you're doing. So if you're a couple that is feeling disconnected, you've kind of fallen off track, but you're not ready to give up. You still love your person. You just don't know how to get back that connection. don't worry, we've got you.
We are launching a private coaching program, and we're going to take on only 8 couples. We're going to meet the 2 of us with you privately, and we're going to do that over a period of time. We're going to work you through the Relationship Renovation Workbook, which is an amazing tool. And then there's a few other ways in which we're going to support you that I think are going to be just fantastic.
So get ready for the We transformation. We can handle this. We can communicate clearly and with compassion, even during difficult times, yes. And we can feel more deeply, intimately connected.
So if that's something that you're interested in, all you got to do is send us an email, coaching@relationshiprenovation.com. We'll schedule a 30-minute discovery call with you. That'll be completely complimentary. We're going to hear about what's going on for you guys, and we're going to tell you about this super exciting program that we're launching.
We really cannot wait to begin this journey with you.